Live. Now I'm live. Okay. Hey, I'm Dr. Ellen Wood. I am live tonight with Seattle Sperm Bank, and I am one of the physicians at IVFMD. My office is in Cooper City, and I am one of the 12 physicians that we have. I've been with them for 20 years. I'm on the IVFMD website tonight. You can also follow me at Dr. Ellen Wood on Instagram, as well as Dr. Ellen Wood on TikTok. So I'm waiting for Seattle Sperm Bank to join us. The wonderful host that I've talked to for the last multiple Instagram lives we've done is Alyse, and hopefully she'll be asking to join us very shortly. We're here tonight to answer all of your questions regarding donor sperm and other questions regarding infertility. So just invited Alyse to join us. So this is going to be another exciting hour that will answer your questions. We have some submitted earlier. Hey, Alyse, how are you? Welcome, welcome. Oh my goodness. There we go. Okay, good. I wasn't hearing anybody before, but now I got them.
Awesome.
Perfect. Excellent. Well, welcome. This is so exciting. We're back again. We did have some questions submitted earlier. I introduced myself earlier. Again, one of the physicians at IVFMD. You can follow me on my Instagram as well as my TikTok. And you can introduce your bank and how kind of we partnered with this whole thing.
Yeah, hi, I'm Alyse. I'm over at Seattle Sperm Bank. I'm one of the clinic relations managers, which means I talk to all the clinics, including IVFMD and Dr. Wood, and we have a great relationship with them. If you happen to be a patient with Dr. Wood and you were using our donor sperm, you get the benefit of having our sperm on site, which means you don't have to worry about travel delays, you don't have to worry about shipping fees. Everybody is there ready and waiting for you. And so it's awesome that we get to do this as well together, where we get to answer we have Dr. Wood to answer all the medical questions that we get on our end. We like to have the physicians and the healthcare team answer those because you guys are the experts and you know there are so many unique cases. And then I'm here, so if you guys had any donor-related questions or questions for the bank, I'm happy to assist.
Okay, excellent. I just actually have a question because I had a couple in today. And they had gone with a different bank other than you guys because they were not, I don't know, I'm not like, I don't go and pick the donor sperm myself. So they actually made me think when I talked to them today that it would be cool because Instagram now, you can put on a third or a fourth person to actually have a couple on who actually used your sperm. And to talk to them and about how they chose your sperm. Because this particular couple, I said, you know what, I really love Seattle Sperm Bank. They did one insemination with, I think, a donor somewhere, I forget. They had to wash his sperm, and his samples didn't turn out that great. I was not impressed, but her ovulation was great. She's only 30 years old. And then the second cycle, they chose a second donor, and they choose an IUI sample, and he had actually better samples than the first guy. And I said, you know what, I said, Seattle blows these numbers away. I go, why didn't you choose them? And they said they didn't like the fact that they couldn't see more adult pictures and they didn't have enough family history. So yeah, they said the other banks, and again, there was one in California, said that they provided more background information on the donor. And again, I've never particularly looked into it myself, so I don't know.
Yeah, that's surprising. Yeah, we don't have any adult photos at this time. We do our best to not only be supportive of everyone out there using the donor sperm, but we try to be supportive of the donors themselves. So at this time, we don't have the adult photos. On top of that, we don't want to have any kind of these model-esque photos of these gentlemen. So we get to know them personally. We have photos ourselves, and they're just candid photos where they come in during their visits. And so we kind of use that information and knowledge to help guide and help understand. So if anybody was out there and they were just kind of struggling because they are looking for adult features that they're not seeing in the childhood photos, we will, I mean, the consultation's free, photo matching is free, and these are all, you know, the photo matching is a hand selected thing that we do on our own. It's not going to be some computer generated match. We're not going to say, oh, he looks like The Rock. You know, we're going to tell you his nose looks like this, his jawline looks like this. Oh, and when he comes in, he always tells us a joke. Or he's really shy, but when he opens up, he's really sweet. So we get to know them, you know, as a thorough whole person, instead of just one snapshot in time, which could be a really nice photo and maybe not true to who this person is. As far as the family history, that's interesting that someone felt like we didn't have enough information. We do a 4-generation family history.
Oh, wow.
Yeah, I mean, it's pages. We dig really deep. We ask about grandparents, what they've passed from, if they've passed. We get into the parents, we get into siblings, we ask about their own children if they happen to have any children. It's very in depth. But I'd love for someone to reach out, you know, is there something specific that they were looking for? Because really we're here to walk alongside at all stages, that if somebody's looking for something, give us that feedback, you know, if there's something.
I was surprised just because I, you know, they had done 2 cycles. She's very young. She had excellent ovulations. And I was like surprised when they said, well, yeah, I know you recommended Seattle Sperm Bank, but you know, they just don't give us enough information. I was like, really? I'll just ask her about that tonight. I mean, you know, hopefully this 3rd cycle, if they're using the same donor they did the 2nd time, hopefully this 3rd cycle works. But if not, I mean, again, I'm going to recommend they kind of just reach out to you guys personally and say, hey, this is what we're looking for. Can we get this from you? So,
yeah, and then they can send us photos of the donor that they're aiming for, and we can try to match that photo as well. You know, and then we'll go through it, you know, and it'll be someone who knows this donor. So, yeah, and then if there's a deeper dive, if there's something specific that they're looking for, you know, give us all the information. We'll dive. We'll try to put this family together.
right, but yeah, it just gave me an idea. It's like I would love to, you know, in the next one we do, kind of just interview a couple who has kind of gone through the selection process and kind of like how they did it, what they looked for, what they, you know, I just think it's kind of interesting. I mean, anytime I kind of present it to patients in the office, I kind of show them the website, I show them what the criteria is. And I said, you know what, it's just kind of like online dating. Like, you know, and you read all these different things. So, all right, so we've had some questions submitted earlier as we started to, you know, put this up on the as a post. So one of the questions that we had submitted last week was, can you request one ahead of time to lead a certain lifestyle before collection? I'm not sure what that means. I mean, that's kind of like, I don't think you pick a specific donor who you think is, you know, not leading a proper lifestyle. I mean, you guys do drug tests, right?
So the samples, I think, speak for themselves. If somebody is doing, you know, drugs or heavy drinking, or, you know, these kinds of substances are going to translate in the sample themselves. We also do physicals, we do metabolic panels. So we're extensively looking at these guys. So it's just not possible that they're going to be able to be on any kind of substance and still provide. And it's not a normal sample we're looking for. It's an above average sample. So it's not going to be someone who barely made the cut. And those kinds of things are just going to really impact their overall health. So it's not something we directly test for, but it's something we'll catch.
Right. But yeah, I mean, indirectly, you can have, you know, someone with a decent amount of sperm, but if their morphology, and which means the look of the sperm, the head, the neck, and the tail, if they have very few sperm that look normal, well, these are not gentlemen that are going to be chosen to donate. So I think that which is unfortunately something that I can't do with eggs. You know, I can't look at the eggs before I get them. I can just say, hey, we don't want you doing this. We don't want you doing this. We don't want you doing this before I take out your eggs. But your eggs are what they are when I take them out. Then I look at them and I'm like, were you doing it? And oh, no, of course not. You know, you didn't give me $5,000 worth of medicine. No, I didn't have a drink, or I didn't smoke. You know, but with sperm, at least you have an easy way of telling him before you say, hey, yes, you could donate for us.
Right. Well, and additionally, when guys are coming into the program, if they had a beautiful, perfect sample, but their personality doesn't quite match, we want these guys to have, we want to be able, we want them to represent our program. We want them to represent us. And we definitely put ourselves in the patient's shoes and just, you know, would I want this guy to be my sperm donor? So if they come in and they kind of have a rotten attitude or you know, something, they won't make it in. So it's kind of a whole person we look at.
Yeah,
So
there's just a comment
yeah.
on the chat. It says, the donor I picked at Seattle Sperm Bank was also another cryobank, and honestly, Seattle had more information about his personality than the other one. I did see his adult pictures on the other page. Interesting. That's very interesting.
Oh, that is interesting because
Yeah.
that's something that's kind of a red flag for us. Guys aren't allowed to be in two programs. How of the number of families. So that's really interesting. I'd love you to send us a message. Yeah, we don't want that. And I feel like our donor coordinator does a very good job of kind of rooting this out to ensure that's not happening. Additionally, though, we also do background checks on our guys. We do criminal background checks and we fingerprint them. So we're pretty thorough.
That sounds important.
And then something to consider is when we are doing these collections, they don't actually get released for use for another 6 months. So if if we did see a decline in their samples over time, we will potentially pull them from the program. We definitely pull them aside and say, hey, what's going on in your life? And sometimes it's just finals and they were a little stressed out and they weren't sleeping as well. So it's not just a snapshot in time. We watch them over time and we see the samples over time.
Yeah, so that leads to the other question that was submitted earlier. It was like, can there be sperm-related issues even though we get through a reputable sperm bank? It's doubt. I mean, again, you reach for such a high quality product, and when you achieve hitting those parameters, it is quite unlikely that you're going to have that donor not be fertile. I used to be a real stickler in certain sperm banks about making sure the donor was proven, okay? But since we've begun working with you guys, honestly, you guys screen them so thoroughly and are so, let's say, I mean, I can't say picky, but it is. It's you're so
Yeah.
you have such criteria that are so exclusive. It's like you do the different samples. You almost ensure that, like, look, this guy has to be fertile, even though he's not proven. And then once he, gets a pregnancy, then therefore he's proven, and now he's a god in the fertility world. I mean, proven donors are just like, they're like studs, like with horses, I mean, it's the same deal. It is the same deal. I mean, it's true. Come on, like, tell me, like, Barbaro didn't get, gazillion dollars for all the vials of sperm he had. Who's that horse 15 years ago in Florida?
Okay.
No, it was a horse. It was a horse. I mean, but again, it's the same thing. It's like, you're fertile, you have a good gene pool, you have a good gene line. So, once that donor achieves that first pregnancy, then they're considered a proven donor. I mean, I've looked on the donors that we have, and sometimes it's proven no, proven yes. And in years past, before we started working you, I used to always say to patients, like, look, you know what, just prove a guy who's yes. Just pick a guy who's yes. But I've been so impressed with the way you actually screen the donors that if a donor is not proven, it's like, okay, they've been screened like so extensively that there's very little doubt that his sperm is not going to be fertile sperm type of thing. So,
Yeah, they have to go through a lot, and then their samples, we do test freezes on them. So we'll freeze a test sample alongside the vials that we're selling, and we'll thaw that test sample to make sure that we can prove what you're going to see when it's thawed. So
right,
yeah,
sometimes I mean the one sample I looked at today from another bank, literally his motility went down after the wash. So they had washed it. I guess it was an intercervical sample, and then they had washed it. It was like 58% before when it was thawed, and it was like 54% after the wash, which is like weird. I mean, that shouldn't happen. You should be, like, again, fertile is fertile. You should be pretty consistent, that's just the way it is. That's just, and it's the same thing. It's the same thing with egg donors. Egg donor comes to us, we take out her egg, she gets somebody pregnant, okay? you know, we can sell her eggs to this person, and 5 other people get pregnant. I mean, you're fertile, you're fertile. That's the way the genetic world works. I mean, and that's, you know, propagates society. You know, the better gene pool survives because they're fertile.
Yeah.
All
Also,
right.
these guys, we have an age range for them, so we cut them off
Yeah,
at
we're not cutting them
35.
off. Yeah, we're not having 75-year-old donors coming in.
Yeah, yeah.
I mean, no, it was funny. My medical student asked me, he's like, well, you know, shouldn't they really accept donors who are like, say you're 75 and you have no medical conditions and you're completely healthy. Wouldn't you be a good sperm donor? I'm like,
No,
I'm like,
no.
you know, it's like, but his genes, he's had good genes because he's lived to 75 and he's completely healthy. Like,
Well, too bad he didn't donate when he was
it was
25.
Yeah, exactly.
Yeah,
Then
we don't want them. We don't want 75-year-old stem cells producing
yeah.
sperm cells.
But it was my medical student was a guy, and he was just like, but what you think of it as far as a longevity standpoint? I just thought that was interesting. All right,
Go back
so
and
we got some questions that you guys submitted that were submitted to you. I'm CMV negative. Can I use a CMV positive donor? So CMV, okay, stands for cytomegalovirus, okay? And this is something most people don't pay any attention to, okay? You catch it, like most people don't even know they have it. You may get a little sniffle, I mean, maybe flu-like, but usually not that severe. It's just a virus that is very prevalent, like the common cold, in the world. So the issue with CMV is that it has been identified by the FDA, which governs all these rules to have testing for sperm donors, as something that we need to test donors for, because it can, like viruses, live in semen. And so 75% of the population has had this virus. So we can test in your body whether you have antibodies against the virus. If your body has never seen the virus, then your antibodies come back as negative. Now, if you're doing an insemination and your donor is CMV positive, theoretically, we could be actually putting virus into your body. Now, is it ideal to put virus into your body, even though it's like kind of benign and not really a big deal? Well, theoretically, it's not the greatest idea, but I've had patients before who, again, the only donor, like there was a same-sex couple, the partner was Brazilian. This was the only Brazilian donor that existed anywhere, and they loved him, and he was CMV positive. So they were willing to take the chance. We inseminated her 1 month. 2nd month, she said, you know what, he's positive, I'm negative, can I check? And by the 3rd insemination, she actually was positive. She never had any symptoms, she never had anything. Now, can CMV be a devastating thing if you catch it during pregnancy? Yes, it can. If you are to catch an active CMV virus while you are, like, say, in your 2nd trimester of pregnancy, yes, this actually has been reported as causing 2nd trimester loss. But this is not when we're using a CMV positive donor. So me personally, I don't call it a deal breaker. But I say, if you're negative, hey, look for a negative donor, just for the theory's sake. If you know you're negative and you find like Mr. Right is positive, I wouldn't lose sleep over it. Okay, if you fall in love with this guy, if you were to catch the infection, it is far before you'd have sequelae in pregnancy, because yes, there is literature that says that CMV caught during a pregnancy, okay, can be an issue. Most of the time you get over it in a couple days. It's like a cold. I mean, it's like nothing. So, but it is required that we test for it from the FDA. So I test all my patients who are using donor sperm for CMV. If they're negative, again, I advise them, hey, look for a negative donor. But if, you know, Mr. Right is positive, let's, you know, not count him out. So it's not something that's a deal breaker.
Yeah, and this is something that can happen in, you know, traditional intercourse. You know, you can still.
Yeah, exactly.
Yeah. So it's not something that is just because these guys are donors. It's something that happens just in the world.
Yeah, it's just like you can get CMV from the Publix shopping cart. I mean, I'm just saying, it's such a prevalent virus. 75% of the population has it.
Yeah.
So the other question was, if you have HSV, which is herpes virus, does that mean you're CMV positive? No. Herpes virus is a completely different virus than cytomegalovirus, which is a completely different virus than coronavirus, a completely different virus than respiratory syncytial virus. I mean, these are just viruses that are just out there, okay? Herpes does not have any association with infertility. There's a teeny weeny minute chance that it might cause issues in the lining of the uterus, but I mean, this is a wing and a prayer type of thing when we're looking for herpes in a uterus. I mean, there's testing out there for it, but it's so uncommon. It's not even on our radar. But HSV and CMV are completely different. So the next question here is, what are the stats in doing home versus doctor office? Again, home, this is my take on it, and you can give your take in a second. Okay. So home, there's variables. Okay. Meaning that you can use your ovulation kit. You can see that your cervical mucus looks like you're ovulating, and then you can do your home insemination. So these are clues that you can use just at home to be in privacy and handle this, that say, yes, you are just ready to ovulate. This is the time to place the sperm into the vagina. Okay. Doctors, we're like a little anal retentive. We're kind of type A. Like, this is what we do. We like to see the follicle. Okay. We want to make sure that you have an egg on ultrasound. We want to make sure that it's the right size. We want to make sure sometimes your hormone levels are right. Make sure that our timing is perfect. So we just take it to the next level. Now, some people are very in tune with their bodies. They can say, absolutely, like, I feel my ovulation, my mucus is clear, my kit says I'm ovulating, like, there is no doubt in my mind that I'm ovulating. Okay, I'm going to spend my $1,000 on sperm, and I'm going to have my partner put it into my vagina. I mean, and yes, that's great. That's great. But a lot of people aren't in tune with their bodies. I've had so many patients that have been like, I'm like, sorry, you weren't obvious. And I just think about it, they told me when they put the sperm in, I'm like, nope. And it just, so we take a lot of variables out of it. And the reason that I'm just so pro taking the variables out of it is just because sperm's expensive. I mean, I'm sorry, you guys have a great price point, okay? But I'm sorry, it's still very expensive. And because it's so expensive, I like to check off all the boxes. Absolutely. There's the follicle. There's the egg. Yep, lining looks great. It's not too thin. Like, everything is perfect. Check, 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 to maximize the chances that when we put that sperm, now we put the sperm directly into the uterus, okay? So when you're putting the sperm into the vagina, actually only 1 to 3% of that sample makes it into the uterus, okay? I put it directly into the uterus. So I bypass the cervical mucus. I bypass the cervix. I get it as close to that egg as I possibly can when I'm putting it in there. So this is just why, I mean, again, I'm a doctor, but again, this is why I do this. I mean, and I'm not saying home insemination doesn't work. It does if you have if you have that timing, right on, absolutely, home insemination works. So, Alyse, do you have stats on how many patients because I don't know, because I'm the doctor, how many patients of yours like go with home insemination and just try themselves, and how many send it to a doctor's office?
Yeah, we don't have that kind of data. But I have seen some studies that it is higher in an office. I've seen studies where it's, between 5 and 10% at home, and between 10 and 20% in an office. I've seen, that kind of bubble.
Yeah, well, as I said, you guys, with your sperm in our office, we're like 30% per cycle. Like, it's ridiculous.
Yeah, and it's definitely it's when you're going into office, you were tipping it all into your favor. You are reducing all those variables. We have great stories of patients who did it at home and were successful on the first try, and hurrah. But I mean, in both cases, the first try is, it's going to take multiple tries. It's not, it's not the end of the line when the first try isn't successful. But yeah, you are tipping it into your favor when you go into an office and you confirm that ovulation. But yeah, like you were saying, if somebody is really in tune with their body, they're very comfortable with it, we require you to be in contact with either a physician or a midwife, to kind of sign off a form on our behalf so that we know that you have someone that you're connecting with and you're touching base with, so that you aren't spending not only financial but emotional time going through these cycles, and kind of check some of those boxes. You know, if there is something that's going to prevent you from getting pregnant, we don't want you to be at home and frustrated and
Yeah,
not
no, it's just frustrating. I mean,
yeah.
the other question was, it's like, can I get pregnant at home insemination either using CMV negative or positive donor? So the CMV status of a donor, like positive or negative, doesn't really matter on the success rates of getting pregnant. It's just a matter of you knowing, are you willingly exposing yourself to a virus that you didn't have? I mean, that's all. I mean, and
Right.
again, as I said, it's not a devastating problem unless you're actually, with pregnant. But so that shouldn't matter. CMV negative doesn't affect the effectiveness of the sperm.
Right.
Sperm is based on, how much there is and how fast it's moving and what it looks like. That's what bases the sperm success. So the presence or absence of CMV is really not even an issue.
Yeah, I think it comes down to everybody's experience is pretty unique, and your physical circumstances, your financial circumstances is going to be unique. So it's just touch base with your healthcare team and figure out what is going to feel right for you and for your journey. If you feel like, hey, let's start off with home insemination, great. Let's start, hey, I'm not waiting, I'm not going to wait around a bunch of months to see if home works. Let's go straight to Dr. Wood. Let's go straight in the office and let's be pregnant now. So it's all about, what you're comfortable with and what you want to do.
Right.
But
And
yeah.
again, and we're
Yeah.
all about efficiency. Okay.
Yeah.
I mean,
Yeah.
I'm sorry. I mean, yes, I love my patients when they come in to meet them, but again, I don't need to know them for 2 and 3 years. Okay. I mean,
Yeah.
yes, as some patients we do know for 2 and 3 years, and it's a lovely journey together. But I look at people, I'm like, look, my job is to get you pregnant and get you out the door. Okay. Like that. I mean, that's just me. That's just me. I mean, yes, I would, love to be warm and fuzzy and let's go out to dinner on the weekends, but no. You come to my office, okay? That's my job. My job is to get you pregnant, get you with a healthy pregnancy, send you on your merry way. And then you send me a baby picture that I can post on Instagram. Then you send me a baby picture.
Yeah, tag us.
Yeah, you can send me a baby picture. I always need my Wednesday photo of the day. I just got one today. I was so excited. I'm like, hey, can I feature you my photo of the day? But yeah, just that's my job. I mean, my job is to just, get it done as fast as possible, get it done as efficiently and cost effectively as possible, okay, and send you out there with a healthy baby, because that's what you want. You want a family, and I want to help you have that family. So that's really what my goal is. Now, the fifth question you guys sent us earlier: how long does IUI sperm last in the reproductive tract post thaw? Hey, good sperm lasts a long time. I mean, minimum, with good sperm, 2 to 3 days. And some guys, they can even have some little guys twitching out there at 5 days. I mean, they go and they just go, and we stick them in the uterus, but some of them even can leak out and hang in the cervix and make it there. I mean, they can last a long time. I mean, good sperm, it's surprising. Now, your egg, on the other hand, only has 18 to 24 hours to get fertilized. So that's why the best time to inseminate you is just before you ovulate or just as you're ovulating, okay? I mean, we like to do 2 inseminations just in case. I mean, women don't always ovulate exactly when they're supposed to, okay? I mean, we think they should, but no, that doesn't happen. We give them a shot. They should ovulate 36 hours later. Some ovulate 32 hours later. Some ovulate 40 hours later, 42 hours later. So because of that, that's why we like sperm kind of on both ends. We like some sperm before you ovulate. So these guys are just waiting. And then, if these guys didn't find your egg, we stick in some more sperm after we ovulated in case you ovulated later. So these guys can come and get it. I mean, it's just like a sperm egg sperm sandwich. So that's why we like to. Yeah, it's an ovulation sandwich. I mean, we just like bombard that egg. I mean, we're talking, come on, this poor egg. One little egg, okay? 10 million sperm over here, 10 million sperm over here. I mean, come on, 20 million sperm going after one egg. Like it seems impossible. Everybody doesn't get pregnant, which is what, the patients are like, how didn't I get pregnant? I go, I don't know. I don't know. But, average success rates for IUI run average 15%. I mean, that's what we quote the stats are. Again, I said with Alyse's sperms of Seattle Sperm Bank, I mean, we're in the 25 to 30% range. It's just because we bombard the egg with such ridiculous amounts of sperm. Our success rates with her sperm are crazy. I've never seen such high success rates, which is why I'm such a fan. Because again, efficiency. So let's see, a couple more questions, and then I'll get to the ones that just have come through. I've heard donor sperm may not be compatible and reasons for failure. That's not really true. I mean, it's kind of like your husband, if he's not compatible, like it's pretty impossible for you to find a donor that you have an autoimmune problem with. I mean, every once in a while we see it if like cousins get married, or people are too kind of like HLA compatible, but it's just really, really, really unlikely that there is an incompatibility with a completely anonymous donor. I mean, again, I can't say it can't happen, but I don't think that, immunology and a donor really plays a role in that type of thing. Now, you might have an immunologic problem yourself. It has nothing to do with the donor. Like your body just may be on a heightened immune alert, and it just doesn't we're not talking the donor, we're just talking sperm in general. There are patients that we see that do have immune reactions to anything that is foreign that is inserted into their body. Now, it doesn't matter if it's a donor, if it's your husband, but we do see that. So, but the likelihood of that in a situation where somebody just needs to get pregnant with a donor is extremely rare, extremely rare. So it's not something that is normal at all. So now we have a couple questions here. Oops, let's see. Let's go back to where we started here. Where are we? Okay, we got the donor. Okay, got the question. Let's see this next one. What is the difference? Okay, so what is the difference between IUI and ICI samples? Okay, so you can get into that. I mean, I can answer it, but that's your business. So.
Yeah. So our IUI vials are sometimes called the washed vials, while ICI is called the unwashed. So IUI is intrauterine insemination. So that's going to be the doctor office where Dr. Wood is going to bypass the cervix, bypass the vagina, and put the sperm right into the uterus. And so we want that to be washed and clean and remove other things in there. We have a 10 million motile guarantee on that one, and it comes in 0.5 ml vial sizes. Our ICI or unwashed is going to be just the ejaculate without removing.
By the way, the sperm that I just reviewed of the couple that didn't think you guys gave enough information, their 2 IUI vials were under 10 million.
Ooh.
I mean, 8 million is fine. And I think it was 6 million, 8 million or something like that. So, I mean, it was enough sperm to get them pregnant, but still I was like,
yeah. Well, like, yeah, we will replace those vials. It's from time to time. We have a 0.01%, rate for low vials that we get reported, and this is something we monitor very closely, and we replace those right away. If
I mean, I didn't want to go into sperm bashing, in the consult with these guys. I mean, because I've had patients get pregnant with 2 million sperm. I mean, I think a fertile guy can get you pregnant with 2 million. I mean, honestly, that's plenty of sperm for a fertile guy. But I'm really impressed with your 10 million total motile guarantee. I mean, I told them a story of a friend of mine. She was 39, AMH was 0.3, and her first couple vials from this bank, they were literally under 2 million after a prep, because it was an ICI sample we prepped. And I said, look, you need to get your money back. So my head embryologist said to me, he had to sign off on it, and he goes, it's like, you think donor sperm's going to work? She's 39. She has an AMH of 0.3. Like, I'll sign it, but that's not the sperm that's the problem. I'm like, look, that wasn't enough sperm. So they liked this guy, so they had bought 2 more vials of him. We prepped them the second time, and I think we were like 2.3 million and maybe 3.1 million, still suboptimal. But and I said to the patient, I said, look, you're 39, you're AMH, you hardly have any eggs left. You have IVF insurance, like you're gonna need IVF. Okay, that's what I told her. And she's like, okay, let's just do this insemination and then we'll talk. I do the insemination. Woman gets pregnant with twins. She has a 6-year-old boy and girl right now. Like, really? With 2 and 3 million sperm inseminated. So I'm not saying, so what it wasn't saying to these people, it can't work. Okay. Yeah. Because obviously it did. I mean, hopefully we did get the credit for the first couple vials, but 39 years old, lousy. It's just, it's so, but
we don't, yeah, nobody should be stressing about low count. Yeah. You know, this whole process is intense,
but, and hard. If you get 10, you can just breathe. You're like, okay, I got enough sperm in me to inseminate the world, like to get the world pregnant. I mean, it's over 10 millions, but a lower count, even though you got, which is again, I think is very, honorable to say, hey, you only got 5 million of my sperm. And I would say, hey, that's plenty to get you pregnant, but you guys will credit their vial. Like, and sperm is all about numbers. Numbers. I mean, like, just, hey, the more the merrier, the more sperm. And over 10 million, it's kind of, I did a study in 1998 that showed even 10 million or 100 million, it's the same pregnancy rate, but still 10 million is really our benchmark. Okay. And I just think that is so great that you guys guarantee that, because then, we as doctors don't have to say, oh no, there was a problem with your sperm sample or anything like that. Like, nope, that definitely wasn't sperm.
Well, in our ICI, the unwashed ones, we actually guarantee 15 on that one, 15 million.
God.
Not washed. So we want it to have a little more, since we know it has to go through the vagina and the cervix and then still make it in there. So load the bases a little more on that one. But that's the difference between the vials. They cost the same. It's just, we don't want to be a barrier between whether you're going to do home or unwashed or washed. Some clinics want washed, some want unwashed. So they're priced the same. They have it was
just very interesting, because I sat with this couple just today. This was today, and I reviewed their samples that we washed and the numbers, and I sampled that that were the IUI that were what, and I just kind of like, I'm like, yeah, they're good, like, and that's when they said they didn't think there was enough donor information from you guys. So anyway, they're going to try one more time with the second donor they've chosen. But
I hope they get pregnant. I don't care.
Hey, me too. I mean, there was enough sperm in all those vials to get pregnant. It's just like when we see your samples, it just makes, like, as doctors, we're like, wow. Like, we
don't do a regular count. We don't just count modal. It needs to be progressively modal. So it's not just something that's moving and chasing its tail. It's something that's moving forward. We don't, just because you're moving, we don't.
But he's going like this.
Yeah. That's not modal for us. Modal means, and we only do progressively modal. So it has to be traveling somewhere.
He has a goal.
Yeah. Get to the egg right now.
They're heading there, just like, they're going straight. They're in
the lab, and we're like, you better be getting to the egg or you're going in the trash.
All right, so what's the maximum amount of time your donors can donate?
Oh, that's a great question. So we don't limit how many times they can come in. We ask for them to come in for 6 months at least. Most guys come in for a year or more. Our cutoff is at the other end, at the family limit. And so we'll cut them off at 25 families. But in reality, we're cutting them off before then, so that we don't run into any issues getting there, but also so that we have enough for siblings if any of those families wanted siblings. So in reality, we don't see guys hit, just donate enough to produce that many families.
Excellent. So it says, is it just me, or does it seem like there's a small amount of donors online? I don't know. I don't know how many donors do you have? Should we call? Are there even the ones online don't have vials listed? How many donors do you guys have? I don't know.
Yeah, it varies. I want to say it's around 200. Depending on what kind of limitations you're putting in the search. But if if there's a donor that you're looking for, we've got wait lists, and we really have a little more inside information about releases coming up. So give us a call. Let us know what you're looking for. Sometimes we get a little heads up on guys that are about to be released, guys that have wait lists. And when you find that guy that you like, purchase them, because they could be in high demand, and once they're gone, they're gone. So we offer buybacks. So if you haven't shipped out vials and you were like, oh, let me get this many vials, and you find, man, I didn't need that many, we'll buy them back at half the cost, and then you don't have to worry so much about the financial pressure. On the other hand, if you happen to be successful and you're like, well, I'm not done, but I'm not ready just yet, we'll offer discount storage. And I want to say it's around 400, and that'll give you 2 years. I want to say 400 for 2 years. That sounds high, but we offer a discounted price for storing extra vials if you happen to get pregnant. So yeah, call up. Let us know what you're looking for. We will scour the up and coming guys. We will scour the waitlist guys. We'll try to make this happen. And if you have some time on your hands, you may be able to wait it out and sign up for our newsletter. We put the new guys in there, so sometimes you get a little bit of a heads up at the beginning of the month.
Yeah, and time is all about age. So as women get over the age of 35, we can't really wait that long. We have to be very proactive about this whole thing.
Yeah.
So another question: how much does your services cost in my office without medical? So the way it works when a couple comes to me, whether it's a single woman or a same-sex couple, and they're looking to use a donor to get pregnant. Basically, what I am going to do is I am going to initially evaluate that woman who wants to use the donor sperm for health. I am going to look at her egg reserve. I'm going to make sure her fallopian tubes are open. I am going to make sure that all of her thyroid is okay, her prolactin levels are okay, all her vitamin levels are okay. I'm going to make sure she's not anemic. I'm going to make sure she is immunized against German measles and chickenpox. I'm going to make sure she is negative for Hep B, C, syphilis, HIV. I'm going to screen her for diabetes. I'm going to screen her for an enormous amount of things, including genetic disease, to make sure that she doesn't carry anything that we won't want to have in the donor. So we do a medical evaluation, which in general is usually covered under diagnostic benefits for insurance. And then once medically we know that she is healthy, then we'll say, all right, now you can choose your donor sperm. You are CMV positive, choose anybody. You carry cystic fibrosis, make sure that your donor doesn't carry cystic fibrosis. Your fallopian tubes are open. Your egg reserve is decent, but I still want to make sure your ovulation is strong. So I'm going to monitor your ovulation and tell you when's the best time to put the sperm in. And once we do that, okay, and we make sure she is like A-OK in tip-top shape, then we go and do the inseminations. I think to thaw sperm and inseminate runs around $300, something like that. It's not crazy expensive. Now your sperm costs $800 or $900 a vial. And we usually do 2 vials a month, again, just to ensure that she's exposed to enough sperm at the right time. So it's not crazy expensive. And I really personally feel that if we do this comprehensive evaluation before somebody actually tries, it completely stacks the odds in their favor that this is going to work with either the first, second, or at the most third time. And if it's not, we're missing something. Because the patients that come to us looking for donor insemination, you guys aren't infertile. Like, you're just lacking sperm. Like, you're not infertile. People who come to me with infertility issues, it's like, I've been trying for 2 years, I've been trying for 3 years, I've been trying for 4 years. You don't have sperm, you're not trying. So most of our patients are successful within the first couple of months because we make sure that there are no other issues at play when you go to do this. This is why I get so excited because, when somebody comes to me and they're 30 years old and they want to try and have a baby, I'm like, yes, I got this. I'm like,
and our vials are $850 each.
$850, okay, I wasn't sure.
But it's, like you're saying, it's really important when you're putting that investment into the vials to kind of get a thorough check before you go into it. make sure
Yeah,
that
I mean,
it's all
again,
back in your favor.
they're not ridiculously expensive, but they're not cheap. So let's make sure that we got an egg, we have a healthy body, like we're all optimized. So then when we put that sperm in, that it has its best chance of working. So when this question was, how does the IUI process work? And somebody answered, it's like a PAP by inserting a small catheter into the uterus. Yeah, so IUI is, I mean, it takes 5 minutes. I mean, it's super easy, but the timing is so important. So basically what we do is we just put a speculum in, okay, just like you'd have a PAP. We clean the cervix, get out, because normally you have mucus coming out of the cervix, which means, I mean, when we see mucus coming out of the cervix and we're doing insemination, we're like, our timing is right on. Like, we are like, you have, I mean, like, it's terrible. Gynecologists were awful. Like, we put it, oh my God, you have beautiful mucus. We're just, every doctor's specialty is weird, We're like, your mucus is beautiful. I mean, so when we're putting the sperm in, I mean, I put them directly into the uterus, but that mucus is so friendly. If any sperm leak out, it's super friendly. Those guys could even make it up there. But that means our timing is spot on. Like this is just before ovulation when that mucus is coming out. So we put this little teeny weeny catheter, we slide it into the uterus, okay? We expel the sperm into the uterus, and it's a teeny weeny little pellet of sperm that stays in the uterus, and literally within minutes, it's out in the fallopian tubes looking for something to fertilize. We have you rest on the table for like 5-10 minutes after the procedure, and then you can get up, go about your day. I mean, there's no restrictions. And then we do it again the next day. So super simple. You might feel a cramp as the catheter enters the uterus. So some people are like, ooh, like, and I'm like, hey, I'm in the right place. I mean, like when you feel that cramp, we're like, that we're putting the sperm right in the right place, but it's not a bad cramp. I mean, it's just like a little like, ooh, like as you go through that cervix. But it's a super easy little procedure. And again, there's no restrictions after it. So, and again, it's just better sperm exposure than home insemination, which again, I'm not saying doesn't work. It's just we get the whole sample where it needs to go.
Real quick, you were just talking about the whole write-up. You were talking about preconception, and you wrote a fantastic blog for us. It's still on our site. Yeah, we've got the whole preconception write-up from Dr. Wood. So go to seattlespermbank.com and navigate over to our blogs. And you know what? I take it back. It is in our link in our bio. Okay. Yeah. And if it's not, I'll double check it after this.
Okay, yeah, but it's all the stuff that we recommend just before you do this, because healthy mom body, knowing what's going on with her is only going to carry over into healthy baby. So I do that for all my patients. I wrote a blog for you, I don't know, last year sometime, just kind of describing like what we test for and why we test for it, and how we want you to make sure you're taking the proper amount of folic acid and the proper type of folic acid to decrease the chances of birth defects and things like that. So all of that is like there's so much preparation that goes into getting pregnant. I mean, it's a shame because, general populations, we don't have sex. Hey, look, I got a positive pregnancy test. But the people who prepare have the best outcomes. They have the healthiest pregnancies. They have the healthiest babies. They have the best experience. If you've actually kind of just prepped yourself for this and you've really stacked the odds in your favor that it's going to work. So that's kind of what I wrote about last year. Just so hopefully you guys should check that out and take a look at it.
Yeah.
So if you inseminate twice, are your patients being charged for one cycle or two? Well, if you inseminate twice, you're being charged for 2 inseminations. So it's 2 samples and 2 inseminations. So, I mean, you can do it just one. I mean, and when people have, significant financial concerns, we can time the inseminations a little bit differently where we can just use 1 sample. But in general, 2 samples is kind of used to really maximize success. But I definitely have in some couples that say, look, this is my budget. This is what I have. I'm like, okay, let's just do 1. I would rather you do, if your budget allows you to do 2, yes, it's going to improve your success. But if your budget only allows 1 insemination, I'd rather you do 2 months of 1 insemination rather than 1 month of 2. So you get that? It's like inseminate 1 vial 1 month. I mean, at 36 hours instead of 24 and 48, and then If
Split the
that didn't
difference.
work, we can use the next vial for the next insemination. So cumulatively, we may be better off. But you know, if some patients are really, really, really strapped for money.
Yeah. We missed the
What we
as
miss?
far as the selection of sperm donor.
What was that? As far as this, I
Um,
didn't understand that question.
are you asking about choosing a sperm donor in general, the process about it?
Yeah, I'm not like
Yeah, yeah.
washed is
Write your
better.
question again. We'll catch it.
Okay. Let's see, is washed or unwashed better? So again, I used to believe up till 5 or 6 years ago that we should use unwashed sperm and then you should allow your clinic to wash it. Okay. This was my philosophy. This was my philosophy that I was taught as a fellow. And the reason was because when you freeze sperm, half of the sperm die in the thaw. So if you get rid of the semen and you get rid of the dead sperm, you're now inseminating a pellet of live motile sperm. However, if you freeze a washed sample that is of ridiculously high quality, when you thaw it, you have more sperm than you'd have after you washed it. So it's all there's I mean, it was night and day. I mean, I changed my entire philosophy again 5 or 6 years ago when I started to see Seattle Sperm Bank's numbers, because I was always taught, no, you wash it because you get rid of the dead sperm, you get rid of the semen, and you get a more motile pellet. Their washed stuff comes out with, you know, 85% motility and 15 million sperm or even more. Like it's ridiculous. So it completely changed my thoughts. And I don't know, it's the way you wash, way you freeze. I don't actually know. I care about the end product. But I was in your bank, your washed samples are better than samples that I have, intercervical samples that I have had washed in other banks.
That's
So
awesome.
yeah, that this came again. I recommended unwashed and let's wash it for 15 years, you know, or more, because that's the way I was trained. And
Both are
then
washed and unwashed. We're freezing and testing. So we, on our end, it's whatever the clinic's preference is, and we're going to test them and ensure that they have that motility in both cases. So you can feel confident if you found your favorite donor and they don't, you know, they only have ICI, you can feel confident that you're going to get our same guarantee. We're still going to freeze that and do a test freeze and check it in our lab to make sure that you're getting what we're saying you're going to get. But yeah, using the wash samples is nice because it's ready to go. It's
ready
nice
to
on the
go.
clinic then. It's
It's
ready to
nice in
go.
the clinic. It's quick. So this question, I wish we could do this. Okay, can you choose the gender of an IUI? Like, wouldn't that be awesome?
Yeah.
That'd be so awesome if you could say by girl sperm or by boy sperm.
Yeah, yeah,
Like,
here's the boy
oh
IUI.
my God, like that would be a
You like
panacea. Unfortunately, the technology does not exist. I wish it did, and even when we did do it in the United States under a protocol, it was called microsort. We still got such crappy samples from when they sorted the sperm for boy and girl. It wasn't even good enough for IUI. But yes, if somebody could invent how to choose the gender of an IUI, oh my God, they'd be the next Jeff Bezos. Like I mean, like
yeah, yeah, without a doubt.
because that if somebody could figure that out to do it efficiently and easily, and get it approved by the FDA, oh my God, yes. The next Jeff Bezos. I mean,
So what
Amazon.
I'm going to be doing on the side now.
I know. Figured out how to sort sperm for gender. Trust me, there's definitely something that would be cool. Is it necessary to see an OBGYN prior to visiting you? No, patients can come directly to fertility specialists. I mean, they don't need a referral from an OBGYN. So some OBGYNs love fertility, okay? And I have some friends, they love it. Like, it's just like they had a really good training program when they were residents, and like they enjoyed it. They learned a lot. They feel comfortable with it. Most OBs really only had a month, maybe two of infertility, and they're just like, go see the fertility specialist. So no, nobody needs a referral to come and see us. Any fertility specialist, you can just make an appointment. Success rate of IUI with stage 3 endo. So many factors. So many factors. You need open tubes. You have open tubes and no immunologic issues, you can get pregnant with IUI. I mean, there's no reason you couldn't. People get pregnant with sex and having stage 3 endometriosis. I mean, many times after 3 inseminations, because if you have endometriosis, we go to IVF because we don't think the sperm and the egg are connecting properly. But if your fallopian tubes are normal and open, stage 3 endometriosis shouldn't be a huge factor as long as you don't have any other underlying immune problems. What does it mean you have a tilted uterus? It just means, so 75% of women's uterus is like this. So when we put the sperm in, we put the catheter in, it goes up like this. It's like an anteverted uterus. And 25% of people have a uterus that goes like this. It's just like having big ears. I mean, you know, your uterus is up, your uterus is down.
That was me. That was me. I had a nice tilted uterus, and I have a 6-year-old.
Yeah, so if your uterus is tilted down, it just means that when they do the insemination, we have to take the catheter and go boop down instead of go boop up. But most people, we start sticking the catheter up because most people's uteruses are up. And sometimes we're like, doesn't go, doesn't go, doesn't go. And then we're like, oh, turn it around. Oh, there we go. So tilted uterus really shouldn't make a huge difference. Another question, my partner's diabetic, 37, not menstruating. That's not a good thing. What would be the first step in seeing a gyno or going to you? Okay. Number one, you need to get your diabetes under control. Okay. So as long as you have a hemoglobin A1C that's normal, diabetic doesn't matter. Not menstruating is a bigger problem. So not menstruating means either you're not ovulating, okay, which hopefully is because medicine can make you ovulate. Hopefully it doesn't mean that your egg reserve is low and you're running out of eggs, and that's why you're not having regular periods. So that's there's two concerns there. But the first step is seeing a gyno. If you want to get pregnant, if that is your primary goal, just go see the fertility people. I mean, we are just efficient. Like, you want to get pregnant, come see us, okay? The gyno maybe is not as well versed in things like that. What's the total normal hemoglobin A1C? So again, normal A1C, less than 5.7. I mean, we'll help you get pregnant between 5.7 and 6.2. Anything over 6.2, I personally really don't want you to get pregnant, okay? I think that it's going to increase your risk of birth defects and increase your risk of complications in pregnancy. So if you're over 6.2 and you're actively dieting and you're on medication to lower your hemoglobin A1C, I mean, I'll start the fertility evaluation with you, and I'll do treatment with you between 5.7 and 6.2. But again, health. Your health carries over to the baby's health. Pregnancy health carries over to the baby's health. I mean, so we really is just health before we help people get pregnant.
I think this yes was referencing the question earlier about how to choose donor sperm. So, yeah. So what you're going to want to do is figure out your plan. What's your family plan? You know, how many kids are you looking to have? Or, you know, what do you want that to look like? Are you doing this with a partner? You know, if you've got 2 women, are you going to carry alone? Is your partner going to carry as well? To figure out what that plan looks like, and that'll kind of help you better understand what donors you're looking for. You know, write down what your preferences are. You know, what are your deal breakers? You know, I need a guy who has blue eyes, and I refuse to look for anybody else. You know, but as the more rigid you are in that selection, it's going to reduce your choices. But think about what's important to you. You know, some people have connected because they found their donor lived a plant-based lifestyle, or they found that their donor was into a specific sport, you know, and that really sparked for them. So figure out, you know, what makes you happy, what are you looking for, and then start going through the donors, you know, just kind of use our selection tool. And if you start to feel a little overwhelmed or lost, or you're not quite sure where to start, reach out to us and we'll do a free consultation with you. We'll help you figure out what's important. We have a genetic counselor on staff, so if you had specific genetic needs, She will sit down with you and help guide you through that. If you needed any other support, we're here.
Excellent, excellent. So
Yeah.
just I have one last question here that because we're running out of time. Is incident insurance, is there so insurance has no infertility coverage. Would it be IUI, be fertility, or fertility? This is such a toughie because some of the insurances consider if you have not tried to conceive with a partner for a year, they're not going to cover anything. But you're like, I'm a same-sex couple. I don't have a male partner. Like,
Yeah.
and they're so ridiculous. And they're like, well, our same-sex partners will cover their infertility because they've been trying for a year. So you have to do insemination with donor sperm for a year before we'll cover you. It's crazy. No, it's
Oh.
awful. It's awful. So if there's no infertility coverage, they will not cover insemination because that's considered that you are infertile on the basis that you not have access to male sperm. You know, it's just, there's nuances and it's very, very frustrating. Some insurances just say they cover infertility. I mean, so it's like, okay, I need IUI. They cover IUI. They don't care whether it's IUI with your husband or IUI with a donor or IUI with anybody. They cover it, you know. And other insurances are like ridiculously picky. They're like, no, you have to have tried for 6 months before. So, I mean, it's nuances and it's very, very,
You
very,
gotta
very
call your
frustrating.
insurance, and it
Yeah.
sucks. And I've been there. I'm going through it myself. You've got to call your insurance. You've got to figure out what your specific plan is because insurance have different plans, have different coverage, and yes, it's work. Yes, it's painful, but it's going to be really beneficial for you to talk to them, tell them, you know, I'm doing A, B, and C, and I need the answers to this, and slowly get through it. But you'll have those answers for yourself, and then you
Right.
can.
And again, there's a question like what insurances cover infertility. You have to, yeah, I mean,
It's plant-based.
I have some Blue Cross Blue Shields cover everything and others cover nothing. Like Aetna's cover something, they cover nothing. It's so employer specific. And then
Yeah.
the last question we have you seen insurance cover majority of IVF for same-sex couples? If you work for T-Mobile, yeah. I mean, T-Mobile had amazing insurance. I did reciprocal IVF on a bunch of people with T-Mobile. I mean, I was like, wow, this is great. And I mean, no, seriously. And then this last question, I turned 4. I'm telling you, they did reciprocal IVF. So she had a job at T-Mobile. The other girl gets a job at T-Mobile. Okay, we used her eggs, put them in her, and they covered everything.
That's
I'm like,
awesome.
you know, what kind of
That's
cell
awesome.
phone company covers this? But it's so crazy that
It's
different
the way of the world these days. You know,
different
they're going to
places
have to do it.
different places cover different stuff. But you know, but again, I'm like, so same thing. Like, get a job at T-Mobile, sell cell phones. I'm like, because they're really great to same-sex couples. Just turned 40, same-sex relationship. What steps should be taken to bring? Honestly, AMH. Find out how many eggs you have. I'm like, at 40, you want a baby? Don't wait. Run to your nearest fertility clinic and get a blood test, which is called an anti-Mullerian hormone test, and find out how many eggs you have. Okay. Then pick, you know, your dream guy, and you guys, you know, get pregnant, but don't wait any longer if you're 40. Trust me, if you want your dream of having babies, don't wait. All right. So I work for T-Mobile. All right, check your coverage because I'm telling you. I'm telling you, a couple of years ago, and Starbucks. Oh my God, Starbucks. Yes, Starbucks has awesome IVF coverage too.
Oh, that's cool.
I had a nurse. Okay, that she was a nurse. That the hospital she worked for didn't cover IVF. She got a job at Starbucks, okay, and had to work there for 3 months so she would have IVF coverage. And she told me that. I'm like, are you kidding me? No, Starbucks has amazing coverage. So, I mean, even if you have another job, get a part-time job at Starbucks. You work there for 3 months, you get IVF coverage, you know, and coverage for this stuff. But these different companies that you just never even think of. And hey, anybody can make coffee. I mean, come on. Like, I mean, it's a busy place, but it's got to be fun. I mean, everyone looks there always happy.
It looks fun. I agree.
Doesn't everybody at Starbucks always look happy? I mean, I'm just saying, like,
Yeah.
they always look happy.
Yeah.
So, but this lady, she was an RN. I mean, she was a nurse. And she got a job at Starbucks just for the insurance.
Get that,
So
get those benefits.
anyway, so happy that everyone like attended tonight. Hopefully I got to most of the questions. Alyse, it's been a pleasure. It's been an absolute pleasure. And what I'd really like to do for the next one is maybe like answer questions for like a half hour, and then maybe get like a couple who's used your sperm, and we can like have them join in, and they can talk about like their relationship with you and stuff, and how they worked with you, and how they I'm in Cooper City, Florida, and how they worked with you. I just think that would be really, and for like great just for couples, how they're going through the process. Because apparently, I did it with an acupuncturist a couple weeks ago, and apparently you can add like a third person in there.
That's awesome.
So, I know.
Yeah,
so,
yeah. Let's make this a whole party.
Yeah, no, but it just was. I mean, it was really nice just to hear her story, and how she had gone through a miscarriage, and how she had worked through acupuncture, and how she'd worked through fertility treatment, stuff like that. So, Dr. Ellen Wood, Dr. Ellen Wood. I'm on Instagram. You can check out my site.
Definitely check out her Instagram. It's so fun.
You got to check out my TikTok. Okay.
Oh, that's right. That's right. Go to the TikTok.
Hey, no, wait, check this out. This is so, but like really, I'm a 53-year-old doctor. Okay. I have over 50,000 followers on TikTok. Are you kidding me?
It's a great TikTok.
It just cracks me up. Like
it's great. It's great. I love the dances. I love the info. You were not crazy. You were fun. You were fun.
Again, hey, my goal is to educate and to convey important information. Okay. No, I mean, that's my whole goal. I mean, come on. And then some people criticize me. You can't dance. Okay. Great. I mean, I'm double board certified. Okay. I didn't go to dance school.
Well,
but again, my information is really, I'm just trying to educate and get information out there. And Alyse, that's why I'm doing these with you, to just really try and I help people. I mean, I just love helping people have babies. I really do. I mean, I've just dedicated my life to this, and I completely enjoy it. So anyway, everybody, good night. Thank you so much. Thank you so much for your questions.
Thank you for having me.
Hopefully we'll see you in 2 months, and we can get, someone else to talk with us and share their story.
I love this plan. All right. Good night, everyone.
Excellent. Good night.
Bye.